All right, everybody, welcome to lecture number one. This lecture is all about safety and participation in exercise, and one of the biggest reasons you got to go over this stuff is for liability for yourself and also for protection of your client or athlete or whoever you're working with. If you do not have someone's safety as a preference while you're looking into getting them started, training especially is the most that's the biggest area where there's a lot of risk. But even just in general, then you are doing a disservice to the people that you are serving. There's a lot of things that can go wrong. And that's kind of how you have to think. You almost have to think pessimistically about the things, the risk reward of what you're doing. Is it worth doing this? Like, what's the worst possible thing that could happen? You have to be ready for those situations because they are going to come up. The last thing you want to do is put somebody in a situation where they are not safe, they get hurt, and then you are held liable. As a professional, you're going to be you're going to have certain things that you have to know how to do, and you have to be well versed in. And if you are not well versed in those, you're going to be held negligent, and people can come after you. Right? I'll give you an example. I work with a wrestling team, a high school wrestling team, and the coach of the wrestling team, who was an assistant coach at the time, this was 3 or 4 years ago, they did a wrestling game or drill or something that involved tackling, and one of the kids on the team broke his femur. The parents tried to sue the school for $700,000, and it didn't work. And now those same parents are coming after the coach personally for the $700,000 lawsuit for negligent coaching. Now, he didn't do anything necessarily wrong. He's going to be fine. But you got to understand that there probably is a point in time where someone will come after you for something. You got to be ready for that. So what we need to do is go over some of those safety concerns and how you need to kind of cover yourself to make sure that you're going to be all right when it comes to starting training and making sure that you're not liable. So the first thing we should kind of do is just talk about what are some of the safety concerns that we would associate with exercise, right? So, you got to look at it from the standpoint of, who is the person you're working with? How experienced are they? What is their training status? And a good example is if you have someone who is untrained, then you need to be very careful about what you do, not only because they might not know how to do everything, but it might be very easy to physiologically push them to a point where they could have an episode of, a bad episode, with their heart rate gets too high, they could have a heart attack, there's a lot of things that could go wrong, especially with someone who's very undertrained. So how you approach that situation is a little bit different than you approach the, professional or very well-trained athlete that walks into your door. So another thing is having advanced type exercises with beginners, right? So am I going to have my, 70-year-old lady who has never lifted weight before in her life start back squatting day one? Probably not. That's a back squat with a bar in your back is a pretty advanced exercise. So I'm not going to do that all for it, right? And some of this stuff probably, if you come up with more examples, seems pretty obvious. But, it's that one time that you slip up that things can kind of go wrong. Another thing that you got to look out for is overtraining somebody. And part of looking at you training people as a whole, it's not just about what you do in the room. It's about what happens outside of the room or outside of the time you're working with them. There's more to training and more to a healthy lifestyle than just exercise and the things that happen in exercise. Sleep is important. Hydration is important. Nutrition is extremely important, right? Those three things alone might be more important than the actual training that you're doing. So if you're working with somebody who doesn't live a healthy lifestyle according to what you are trying to have them do, that person, one's susceptible to injury, but they're really susceptible to overtraining. Now, it's really hard to get somebody to overtrain. The term that we're really going to use is called overreaching. So before you hit overtraining, which is complete burnout, which means you can't do anything else for months. It's almost like if you think about a younger athlete who starts wrestling when they're 3, and they're wrestling hardcore tournaments all year till they're 18. At some point, they're just going to not want to do it anymore. They're completely burnt out. They're overtrained. It's very hard to get somebody to that. So what we usually call steps before that with other people and kind of like the normal Gen Pop would be overreaching. But part of someone getting to that spot quicker is if they aren't following good sleep, good nutrition, good hydration, and the signs and symptoms of that, are bad sleep, right? Maybe they're not able to get good sleep. They don't even have an appetite anymore. They have it takes them a really long time to recover between sessions, like unusually. They have a lot of fatigue, joint pain, whatever. So you have to be really careful with newer people with the amount and the dose that you give them of exercise to make sure that they don't overtrain and overdo it. One of the things I will say, for any of you who are interested in starting to work with people, don't be the person that destroys somebody on the first day that they come in, right? I'm sure it might have happened to you before where it's like the first day it's got to be, we got to set the tone, right? We got to let you know this is going to be hard and we're going to work. One of the biggest things that you can do to help somebody with training, which is really the ultimate goal of all that you're learning here, is to help people, is consistency. Right? If you don't have consistency, then it doesn't matter if you know the physiological adaptation for XYZ. I don't care if you know the ins and outs of all the different energy pathways. I don't care if you can explain every biomechanical aspect of any exercise. If you can't get somebody to commit to the long term, then you are already going to lose. It doesn't matter. So one thing that you can do to avoid that is start somebody where they're at. Don't just destroy them and say that they have to live there, right? And that's a mistake that a lot of trainers and a lot of people make. So if there's one thing you can take away from this lecture, it's that, right? Another thing and that you got to be aware of as far as the concerns that you associate with exercise are all the previous health conditions. I'm just going to list them. They're on lecture 1, the document, so you have them there. Basically, coronary heart disease, respiratory disease, hypertension, history of syncope, asthma, strains and tears, which has to do with muscles and tendons, fractured bones, broken bones, previous injuries, and like heat exhaustion. So those are more of the physiological things that can go wrong or things that you need to really consider, especially the heart issues. That's a big deal. So one of the ways that we make sure that someone is actually healthy enough to exercise is through a PAR-Q, right? A PAR-Q is just it's a standard, essentially exam for somebody, or not really an exam, but it's an essential assessment. It's an assessment that you can give your clients to make sure that they are actually healthy enough to exercise, right? So a lot of the questions have to do with heart issues and irregular heartbeats, if you ever had strokes in the past, because the way you approach exercise, if you've experienced those or you have heart issues, is a lot different than if you don't. Right, and there's a lot of things you have to be very careful about, and your progression is going to be very, very slow. Now, one thing I do want to bring up is with hypertension, which is just high blood pressure. It's a double-edged sword because in order to combat that, you have to exercise. But if you exercise and you overdo it, the hypertension is going to hurt you, right? So it's kind of a tough one where, you have to be very particular with, again, the dose that you give and the intensity that you give. So that's why you have to have a plan in place where you're going to gradually ease somebody into exercise when they have issues like that. We're going to go over kind of how to do that and the different methods that you can use as far as like aerobic training, which is going to do a great deal for people when it comes to improving their aerobic fitness and over their cardiovascular health, right? And with most of the people that you're going to deal with, that's going to be a big deal, is improving that. Movement is kind of a secondary to that, but we'll get into that as we go through the class. So, there's obviously other things you need to be aware of. So just general things when you're in a weight room, your coach or your coach to athlete ratio is a big deal. So I use the word coach. You can use whatever you want, therapist or physiologist, whatever. But the amount of people that you are in charge of is a key depending on who you're working with. So if I'm working with 15 college athletes that I've worked with before for 3 years, I can even probably afford to have more. So my ratio can be 1 to 15 or even more because the risk for each person is very, very low because they're already educated. They know how to use all the equipment. They know how to do every exercise. We already have prescribed loads for them. We already have a general idea of where they're going to operate at. The risk is really low. We've taught everyone knows how to spot each other, right? We know all of them are healthy. We've already done those assessments. We've really worked with them to make sure that they are okay. And our risk is super low if we have a big ratio of people. On another side, now let's say we're working with a bunch of 9-year-old or 10-year-olds who have never been in a gym or lifted a weight in their life. Can I have 15 of them running around at the same time just for me? Absolutely not, right? So if I have 15 kids who have never touched a dumbbell before and I'm trying to teach them how to work on a basic goblet squat, well, that's a lot of people that I need to keep track of, and not all of them are going to get the attention they need to make sure that we get the movement strategy down correctly. Right, that's just one example. Another, you know what I mean? And you could do that all the way. You could have that same example with like the 9-year-olds with your patients who just got out of hip surgery. How many patients could you handle right out of hip surgery as a physical therapist at one time? Can you handle 12? Probably not, right? 3 at most, depending on the situation. Sometimes it might have to be a one-on-one, right? If I have, I have a girl that I'm going to train soon, a 14-year-old girl who tore ACL a while ago, like I need to work with her one-on-one. Right, because just one wrong movement could be an absolute disaster. So we need to really make sure that depending on the situation you're in, your ratio is good to make sure that everyone is taken care of and safe. So just make sure that you keep this as a forefront, right? You don't want to let it slip. Like in your mind, you can't let the fact slip that people can get hurt and things can go wrong. And again, you have to think pessimistically. You got to think, okay, what's the worst possible thing that could happen with this? And really, you always want to pick the thing that's going to give you the lowest risk, right? And you go from there. And again, it depends. Those risks and those rewards are different for each person's situation. So I'm not going to take the same risks with a 75-year-old who just got out of hip surgery that I would take with a 22-year-old college football player. Right, those risks are different, but again, it's still I'm going to weigh the risks and rewards with them compared to the risk and rewards over here. Okay, so the basic point of this, as we've kind of gone through, is that there are safety concerns. Training status and where you're at is a really big one. Understanding the person you're working with is big, and then having the pre-existing conditions identified, another big deal. So usually some sort of like activity assessment like a PAR-Q is essential to have done. Okay, so that's lecture 1. If you have any questions, you can just shoot me a text. I went over that in the syllabus, but please just shoot me a text and we can go from there. Head on to lecture 2.